Many states, including Ohio and Pennsylvania, are seeing a surge in cases of the coronavirus. But if hospitalizations keep increasing, at what point would we start to see a crisis? And will we need to activate plans for field hospitals proposed in the spring? Matt Stone explores the possibilities in today's cover story.
Estimates for active coronavirus cases in Ohio swelled to more than 35,000 this week, more than double the numbers from a month ago. In Pennsylvania this week, more than 2,000 new cases of COVID are being discovered each day, the highest numbers since the beginning of the pandemic. With these rising numbers, are the Mahoning and Shenango valleys preparing for the potential need for more hospital beds? Local health officials say yes. They are looking at hospitalization rates, the numbers of hospital beds and ICU beds being used, and ventilator usage all over the region.
It's really important to know that we have plans in place. We're actively working between the health systems and the health departments, actively working with the zones that have been set up by the Ohio Department of Health and the governor's office.
Before field hospitals are needed, local hospitals are collaborating in every region of the state to make sure one area isn't being overwhelmed.
If we see surges happening in a particular area, those hospitals, those EMS providers in that area are going to be interacting to ensure that patients get routed to facilities that have the availability.
But although there are surges in the coronavirus right now, perhaps due to more easily available testing, there is some good news. Medical experts say people just aren't getting as sick as they were once before. And while more people are getting the coronavirus, they're just not going to ICU units like they were in the spring. Now, the hypothesis is that people are getting better treatments and they're getting them faster. And there's also the possibility that the virus itself has mutated, so people are seeing less severe symptoms.
Approximately 30% of patients who were hospitalized in the spring were on a ventilator. Right now in Pennsylvania, that's about 10.5%. We have improved therapeutics and treatment. We have remdesivir, now approved by the FDA. We have dexamethasone, which is a steroid. It is used to decrease the inflammation, particularly in the lungs and other parts of the body that the virus can trigger.
While we wait for that vaccine, doctors warn people who are older or have other medical issues are still the most at risk for being hospitalized with COVID. So we all still need to do our part to stop the spread. With today's cover story, I'm Matt Stone.